Today, our focus is cardiovascular health, and the topic for today is entitled Healthy Heart, Healthy Pregnancies. Can I have the next slide, please? Just as a reminder that as California Surgeon General, my office is tasked to be the leading spokesperson on the most pressing public health issues, and I am tasked to be the person to convene and to communicate with our partners and throughout California what those most pressing public health issues are. So want to remind folks what our office can and can't do. Next slide. And some updates and reminders for the logistics. Everyone is muted, and there is the opportunity to do Q&A. So please put your questions in the Q&A, use the Q&A. We will do our best to answer the questions. The chat is disabled, so if you have questions, please use the Q&A. We welcome your feedback. This is our email, and the session is being recorded and will be available on our YouTube channel later on. Next slide. Today, we're going to be listening from people. We have somebody that's going to be sharing her personal story about cardiac health. We're also going to be highlighting an innovative program that is out of UC Davis that is led by Promotoras. It's called Healthy Life Dancing Heart, as well as hearing from a tribal community voice, Dr. Antoinette Martinez, on the importance of cardiovascular health, listening to patients and being proactive, and helping people have that voice to be able to care for their own health and be heard. Next slide. So I want to start with and set the playing field for a little bit of data. And this is national data that highlights how cardiovascular disease, heart disease, and this is as of 2023, is the leading underlying cause of death in the United States. So overall, cardiovascular disease, heart disease, is killing more men and women in the United States. Oftentimes, we think of heart disease as a male disease, and in actuality, sadly, it is an equal opportunity disease that impacts both men and women. So we all have urgency to pay attention to not just the men, but more importantly to women's health. And we know that women oftentimes present with varying types of symptoms when it comes to heart disease. Next slide. This was taken from the America's Health Rankings, and overall, and if you are interested, this is a great website. They have data that highlights how cardiovascular disease plays out throughout the country. And in California, 7.2% of people have heart disease. So we have one of the lowest. We are 5 out of 48. They have the data for 48 states. We are 5 out of 48 in terms of cardiovascular occurrence, cardiovascular heart disease. So yes, we have a lower rate of heart disease, but remember, the heart disease is killing more men, more women, and it really does and make a bigger impact in pregnancy and beyond. Can we have the next slide? This is data. Now we're moving into pregnancy-related deaths. So in California from 2013 to 2021, you can see here that cardiovascular disease accounted for 26% of pregnancy-related deaths. And then I want to highlight also that there's also hypertensive disorders of pregnancy, HDP, that accounted for 8%. So really, when you add both of those together, that adds to about 34% in terms of pregnancy-related deaths as a cause here in California. So cardiovascular disease is critically important for us to pay attention to. Next slide. And in terms of maternal complications, so this is complications. So remember, these are precursors to potential increase worsening of the medical condition, and the ultimate would be death. But the maternal complications at the time of delivery, hypertension was the most common, followed by obstetric hemorrhage, followed by preeclampsia. So these are complications. So again, going back to the fact that not only is heart disease a common cause of death, as well as hypertension, disorders of pregnancy, we see it more often also as a complication in terms of delivery. And you can see the trend from 2016 to 2022, the amount of hypertension is increasing overall. So we have work to do in order to address hypertension before pregnancy, during, and then more importantly, afterwards. Can we have the next slide? So as a reminder, overall, in California, pregnancy-related causes of death, heart disease is 23% of the pregnancy-related causes of death. This is important to highlight the fact that this is for all races and ethnicities, and this is very different than what we see nationally. In April of last year, the CDC shared that cardiovascular disease, heart disease, was the most common cause of death, pregnancy-related death in Black moms, and infection was the most common cause of pregnancy-related deaths in Hispanic moms. Substance abuse, mental health was the most common cause of death for white moms, and emboli was the most common cause of pregnancy-related death for Asians. But in California, it's heart disease. And then you can see the other causes being bleeding at 14%, behavioral health 12%, and infection. The other thing I want to highlight is the fact that behavioral health causes are associated with 10 to 15% of pregnancy-related deaths from other medical causes. So mental health does not happen in silo. We are connected mind, body, and you can see that reflected in the data here. Oftentimes we know the importance of, we can see the data, we can read about it, but it's when you hear the story from a patient, from somebody that has experienced that event, that it truly brings to light and more important why do we have to focus on this. And for that, to share that experience, we invited Jenylyn Carpio. She is a sudden cardiac arrest survivor. She had complete heart block when she was 22 years old. She's a wife, mom to one daughter, and she lives in Murrieta, and she's been kind enough to join us. She's getting ready to go to work. So Jenylyn, thank you so much for being available to share your story and to remind us of the why we have to address cardiovascular disease, not only before pregnancy, during, and after. I'll turn it over to Jenylyn.
Hi, good afternoon, everyone, and thank you for allowing me to share my story, Dr. Ramos. It's an honor to contribute to this afternoon's webinar. My story begins shortly after the birth of my only daughter. Overall, it was considered to be a rather smooth pregnancy. So shortly after she was born, one afternoon, I was feeling tired, and we decided to go visit my mom, and I went ahead my mom offered to spend time with my daughter so I can take a nap at her house in San Diego. I don't remember what happened next, but here's what took place. When I went down for a nap, my mom said it looked like I was having a seizure and I was gasping for air. She had handed the baby to my brother and had started to perform CPR on me while keeping the phone with her. She continued CPR until I came to. I was immediately taken to the hospital, and it was there I had ended up learning more about my own health as well as my health history from my mom's side of the family. As it turns out, my mom's father had died from a very young age from heart disease, and his multiple siblings also were diagnosed with a form of heart disease as well. And during the course of my childhood, I had actually had numerous fainting episodes. And I had also learned that those fainting episodes were a sign that could have been investigated further. I actually ended up being diagnosed with complete heart block and long QT. And as a form of treatment, I received an ICD, an implantable defibrillator, which I'm going to have for the remainder of my life. In addition to the physical issues that I had ensued, there was a really strong and scary mental and emotional impact on me. And my message to other women is to please listen to your body and don't be afraid to ask questions. And in addition to that, as much as you can, please learn your family history. As a mom myself, I found that to be very important because, of course, it's learning your family history impacts your children too. So as of today, my daughter is 19, and one of the biggest milestones that we experienced was her high school graduation. It was a milestone for all of us. My mom, who performed CPR on me, is currently well and enjoying the retired life. And I've been a longtime volunteer for the American Heart Association. And I've also was featured in the national campaign for the Go Red for Women, Real Women class of survivors back in 2022. And if not for my mom performing CPR, I wouldn't be here today to see all of my daughter's milestones. Not only did we see her go off, graduate from high school to back in fall of 2023, the next milestone after that is we got to see her off to college, off to Cal State Northridge. So that's definitely something that was a big milestone to us just recently. Two final points from my story I'd like to share with everyone is cardiac arrest definitely happens without warning, and CPR is a life-saving skill. And for everyone to visit heart.org/nation to join the nation of lifesavers by learning CPR. And that concludes my story.
Thank you so much, Jenylyn. You are a testament to the importance of us focusing on cardiovascular health for people at all ages. You know, you were 22 years old, and thank you for the courage to share your story and to motivate others to not only know your history, know your medical history, but more importantly, learn CPR, because you never know when you're going to need that. And for providers, for all of us to know the importance of remembering that cardiovascular disease affects and impacts both men and women, and it really oftentimes can present differently. So thank you so much, Jenylyn. Really appreciate your being here.
Thank you for having me this afternoon. Appreciate the opportunity.
Thank you. So I hope you are now becoming more motivated to do something to help not only educate ourselves on what more we can do, but perhaps to learn about what is available, what is innovative, what is happening that is different, that can occur in the community to help improve heart health. And with that, we have the honor and privilege of having Miriam Hernandez here with us. Miriam Hernandez has graciously volunteered to share about her program. She is the director of the health unit of the community center of the Ibero-American University. For 7 years, she was the cancer development manager for Visión en Compromiso and is currently the director of the career development department. So Miriam, you're going to be sharing the program called Vida Sana, Corazón Bailando, Healthy Life, Dancing Heart. I turn it over to you, Miriam. Thank you so much for sharing what we can do in the community.
Thank you. Thank you, Dr. Ramos, and thank you for inviting us to share this wonderful project that we have with UC Davis, and we call Healthy Life Dancing Heart, Vida Sana, Corazón Bailando. Could you move to the next slide, please? Okay, what is the goal for this project? This is a collaboration between Visión y Compromiso, that is a nonprofit organization that is in the whole state of California, and we are working with promotoras and for promotoras. This collaboration is with UC Davis. We start this collaboration like 2 years ago with the idea about how we can work together, integrating promotoras, community-based organization, plus our community, plus our university or institution that has a resource project. Then in this project, our goal is to prevent heart diseases. How we can prevent these heart diseases? Through exercise, diet, and manage our stress. And we are going to provide this pilot project in the area of Bakersfield with a group of community members, all of them ladies, women, in the age of 35, 45, 50. We have 2 promotoras that are instructors for bailoterapia, and we are going to integrate 2 curriculums. Could you move to the next slide, please? In this pilot, we are going to integrate the first curriculum, that is I look good, I feel good. Me veo bien, me siento bien. This curriculum was developed for a promotor that came to us because when he started getting diabetes, he started doing dancing and also changed the diet. And he explained to us, do you know what? It's something that we can do, not only for me, but also for our community. Then we train promotoras for this curriculum, and they are going to talk with our members of the community about nutrition, exercise, and also how to manage diabetes and hypertension and high cholesterol. The next one, please. Next slide. Then we train the promotoras also with UC Davis. We work together to design the intervention, and this intervention was to have this group of members of the community, 20 members of the community, and promotoras. We are going to provide the dancing, but also the topic about nutrition, exercise, diabetes, and high cholesterol, and how to manage that stress. UC Davis provide the training for them about the project, about the intervention, and how we are going to work with our members of the community. Next slide. But also we integrate this component. Promotoras learn how to take the A1C, cholesterol, triglycerides, and HDL, LDL. And we have the collaboration with a group of people that teach us how to do it. And promotoras were doing this part of the training too. With this group of 20 members of the community, they also provide or did the A1C, the cholesterol level, blood pressure, because we believe that there are these 20 members of the community, if they know their values, they know the numbers, they can be more aware about how I can start to prevent this kind of diseases and how I can start to have a healthy heart. And if I know these values, I know that I have high blood pressure, I can start to doing something. And then the promotoras will teach them how to manage these values and how to work with diet, exercise, and manage the stress. The next one, please. Also, we have an orientation session with these 20 members of the community. And during this day, we provide for them like a 5 stations, and they will move to this 5 station. In the first one, we teach them how to get the blood pressure, how to take the blood pressure, and also the weight. And then we provide also by button to know about the heart function, the different components of the heart function, like a pulse, like when they are sleeping, how the heart is working, etc. And then we invite them to take the blood pressure. We teach them how to take the blood pressure. They learn how to take the blood pressure, and we provide them the blood pressure machine, because they are going to do it during these 9 sessions that they are going to be with us. They are going to take the blood pressure. Then the promotoras, because they took the training to get the A1C, the cholesterol numbers, they took the test and provide to them the numbers. And we explain to them what are the values and what are the meaning for these numbers. And also we get the circumference of the measure of the circumference. Our idea with this, if these 20 members of the community know about their values, they can be more conscious and more aware. And some of them have a high blood pressure and high cholesterol. Then this is the reason why we provide this intervention with UC Davis. And as I explained to you, this intervention now is a pilot, but we have the vision to do it in a big scale and get more people to know about the values and know about the nutrition and exercise and the importance to do it. Next one. Okay, with this, I want to invite all of you to know more about the promotoras, how promotoras are working in our community, and how they can work with us, with you, with investigators, with physicians, nurses, to have a better and healthy communities, and how we can prevent diseases like a heart disease. If we teach our members of the community about the heart, about the different diseases of our heart, and how they can prevent these diseases, how they can do exercise, change the diet, and about nutrition, and also manage the stress, because we know this is a big risk for our heart. They can be aware to change their lifestyles and be more healthy and prevent heart diseases. And work with promotoras. Promotoras are members of the community, that they know our community, they know how to work with our community. Our members of the community trust in them because they build trust in relationship, and they can teach them how to prevent heart diseases and the importance about nutrition, exercise, and stress management. And promotoras are in different areas, regions of the whole state of California, and we are working with them. And I'm very thankful for UC Davis that we are working together for this project, and how we can provide for our members of the community more information about heart disease and how we can prevent diseases.
A reminder of what important partnership is needed in the community. And it really is the community, the promotoras, who can do train the trainer, the best practices, so that people can be educated and not only educated, but then you increase awareness and understanding on the importance of things we need to do to maintain our health. And the fact that you include the bailaterapia, I think that's fantastic. To use a little cumbia, a little salsa, a little reggae dance music, whatever the person chooses to dance to is so critically important, especially right now in California, we're having rain. So walking, exercising doesn't have to be only something that you do outside. It could be the bailoterapia, and it could be done in the comfort of your living room, in the comfort of that classroom that we see there. So thank you so much for all of the work that you're doing, Miriam. And we look forward to seeing the success so that we can replicate your initiative throughout California and beyond. Now we'll take the next slide. Thank you. So Miriam highlighted the opportunities with the promotoras in the Latino community, and I want to turn it over now to Dr. Antoinette Martinez. It is such a pleasure to have Dr. Martinez here with us. She is a Chumash and resides in Northern California, serving as a family medicine obstetrics provider for United Health Services, Inc. She is also the co-director of the University of California, Davis School of Medicine Tribal Health Program in Medical Education and Hugi Wamuk Post-Baccalaureate Program at Cal Poly Humboldt. Dr. Martinez is truly an innovator, inspiration, and a wonderful colleague. And she's going to remind us the importance of listening to our patients, and more importantly, listening to our patients, especially when they are from our communities, whether they're tribal communities, Latino communities, Black communities, because oftentimes they feel like they are not heard. And when we hear our patients, we can truly make a difference. So Dr. Martinez, the floor is yours. Please share your experiences and your call to action.
Oh, thank you so much, Dr. Ramos. Yes, I have to share a couple of things as it comes to listening to understand. And the first one is just a brief recap of our tribal history. It is long, complicated, and rather than looking at the terrible things that happened, we still want to look at the strengths of our communities. Our state of California has the largest population of American Indians in the country, and that is by the 2020 census. Our communities are both tribal communities, 109 federally recognized, as well as many unfederally recognized who are indigenous to California, and many others who come from tribes throughout the country. That is due to our history. Before colonization, every place had a name. Everywhere you look in California, we were there. And our beliefs and our ways, anywhere from 10,000 to 25,000 to 100,000 years of survival. And we did have our own cultural ways and traditional practices. We knew how to live on the land. Coming from that framework, following all the hardships our people have endured through attempts to eliminate us, considering us to be the dying Indian, so many things, boarding schools, etc. We survived. And on that, we build on our cultural strengths as many other ethnic communities do. We thrive in them. Our communities are very diverse, yet often we can have a common language. On that note, there are so many things that we are doing in our communities to rebuild and regain our culture, our language, our ways. And from that, ideally, we would all be healthy. But there are so many issues our communities, as many other communities, have to deal with that impact our health. I wanted to share a story of one such occurrence that happened, just to share how I actually want to reframe what I do and what I share with others. We are looking to the future, and this picture shares the numerous individuals who stepped up to receive doula training Similar to promotores, they actually want to work with families, parents, children, to build healthy communities while also maintaining our cultural ways. This picture below is from our Centering Pregnancy group, and it was an excellent way that our community members connected with each other. It's that connecting to community and building on strengths that is our goal. And ideally, having healthy families and healthy babies. One of those barriers that our community members can have, and that is distrust of the medical system. Up until the 1970s even, we did have women who were forcibly sterilized. So there is a distrust of the medical system, and we need community members to connect with our moms and our families to know that if they have a concern, they have someone that they can talk to. A case in point is a mom that probably about 5 years ago had heart cardiomyopathy, an enlarged heart that didn't work very well, but it was still functioning fairly well. Coming from the premise that she was young and looked healthy, our community member did not see the specialist, although we wanted her to. And ultimately, after having 3 babies, she ended up in severe heart failure, requiring transplant. If I believe we had listened to her and also strongly encouraged her to partner with us so that she could live a long life, she would still be here today. And utilizing our specialists, we could have had her speak with maternal fetal medicine specialists, coming up with plans and partnership. Having doulas now will also help us. We didn't have that at that time, and she did not survive. One of the things I want to tell my moms is I want you not only to have a healthy pregnancy, but I want you to see your child graduate. As our former presenter spoke, you know, seeing your children graduate, seeing your children have their children, our future generations, that is what we have talked about for the beginning of time, looking at our future generations and what we do now, how will we impact our families and our communities? And one of the key parts is listening to understand and helping to guide our members to better health. You know, we're looking at building our community with better supports. So, you know, we have rural communities where they have to travel 2 hours in to get their health care. Access to health care is super important. Having doulas is extremely important, and support systems. In addition, the PREMA assessment, preconception medical assessment, would be an excellent tool. In this case in particular, it would help us to guide that patient about what the risks are, what they were for having another pregnancy, and how being pregnant affects your blood volumes, cardiac output, and long-term, maybe having one child and living to see that baby survive into adulthood is far better. So having PREMA available for our communities will be an excellent tool. Thank you so much, Dr. Ramos.
Thank you. Thank you so much, Dr. Martinez. And again, just reminding us of the importance of listening to our patients in a culturally sensitive way, meeting them where they are, and providing the resources that can so they can have that conversation with their provider. But reminding folks that Prima is one tool that was developed, and Dr. Martinez, you were part of that advisory group to really help folks think about their health before they become pregnant. So would encourage everyone to help us promote Prima. It is optional. It is a quiz that the person keeps the information. It is not meant to be in the healthcare setting. It's just a way for folks to start to think about their health. So thank you, Dr. Martinez. It gives me great pleasure to highlight some of the resources from the American Heart Association. And Dr. Joyce Njoroge is going to be sharing some of those resources available for us. Dr. Njoroge is a board-certified advanced heart failure cardiologist at Stanford Healthcare, a clinical assistant professor of medicine in the Division of Cardiovascular Medicine. And she is speaking to us today as a volunteer for the American Heart Association. We know that for the healthcare teams, we oftentimes have a lot of protocols, a lot of information, but oftentimes the general public doesn't know where to go. And the American Heart Association has done an outstanding job at collating all of that information. And Dr. Njoroge is one of their lead top stellar spokespeople. So the floor is yours, Doctor.
Thank you so much. It's an honor and a pleasure to be here with you guys. I'm very grateful for this opportunity and for this space that is highlighting the maternal morbidity and mortality epidemic in the United States. Jenylyn's story highlights, and thank you so much for sharing, but really highlights the real and scary risk that can affect anyone at any age and at any time. And I think there's the additional component of this postpartum period. With so much going on, it's really hard to be able to focus on mother and their needs and care needs as well. But it's very important nonetheless, and to be heard and to understand your symptoms that may arise during this time period. So there are some resources on the next slide that are available for providers and community too. The first one is going to the heart.org nation to learn information about traditional and hands-on CPR. If you scan this QR code, it'll take you to the website, which also provides really important data and statistics, such as the fact that 70% of out-of-hospital cardiac arrest occurs at home, but only 40% of those are able to receive immediate CPR. And one way that we can battle this and make that statistic even improved is by having resources to learn what appropriate CPR measures and interventions are. And you can even just watch a very quick 90-second video that shows you a lot of information about how to provide effective CPR. I also appreciate that these resources give you updates on some things that weren't actually necessarily common knowledge, such as the hands-only CPR, and demonstrating that data has shown that out-of-hospital cardiac arrests that are treated with hands-only CPR are as effective as the prior recommendation to do hands and breath assistance. So again, highlighting major and important updates that may not be common knowledge, but can be life-saving. I think a fun thing that you can find on this website as well are some songs that you can reference when you're thinking about what's the right tempo for your compressions. And for example, some songs referenced by Beyonce can be commonly used and known by most of the common population. So the next slide highlights another very useful tool called the Prevent Calculator. This is a calculator that has been updated and really helps provide an understanding of an individual's risk of developing overall cardiovascular disease and cardiovascular events, with the opportunity to also see what their risk of developing atherosclerotic cardiovascular disease, such as heart attacks, and their risk of developing heart failure. So it's a very simple tool where you can just input either a finite number, such as your cholesterol levels, or a yes or no on diagnosis, such as of previous kidney disease or previous diabetes. And at the end, there's an explanation for your risk of developing that condition and your risk of having events related to your heart. So this can be used again by professionals. It's quite useful, but it's important to enable also the community so that they can understand their own risk, especially when we talk about a lot of the medical distress that affects many populations. Giving them the tools to understand their life and their disease risk is important. And then on the last slide that I have, the two different QR codes here, depending on your phone, will take you to an application by the AHA that shows you all of the guidelines. This is very helpful for providers to understand, in a world that's continuing to develop and continuing to evolve, what are the current guideline recommendations for treating common conditions such as atrial fibrillation, or importantly, hypertrophic cardiomyopathy, which you may know has undergone a significant growth in therapeutic options there. So you'll see a number of common cardiac conditions and be able to easily access, as Dr. Ramos mentioned, in a collated form, recommendations for treatment and management and when to refer patients for evaluation. I think a lot of this is important in the pregnancy space as well, even though a lot of this information is made for the general population, because the same risk factors that increase your risk of developing cardiovascular disease can increase your risk of developing cardiovascular complications of pregnancy. That Dr. Ramos highlighted is currently the main contributor to our horrible mortality and morbidity in pregnancy. So thank you again for taking the time, and I hope these resources are helpful.
Thank you so much, Dr. Njoroge. These were fantastic. Again, like you said, these can be used by everyone and all of us. And I think these apps are fantastic because as providers, sometimes you need all of the information literally at the tips of your fingers, and many times the protocols and the recommendations are changing. So thank you, American Heart Association, for collating all of this and making this available. I hope you've come away and learned some new information, but then more importantly, I would ask that you share the information that you've heard today with others. This is an opportunity for all of us to realize and to let others know how important it is for all of us to address cardiovascular disease, because we need to save lives, men, women, and more importantly, for Strong Start and Beyond, the lives of mom, because we know that the mom's life impacts the family, the baby, everybody else around her. So I know that Colette is going to finish us off, and I do want to put in a plug again for the Prima, reminding folks to please share it, text it, social media, on our website there at osg.ca.gov/Prima is information not only for the quiz, but also a lot of other supporting information, social media toolkits. So with that, I will turn it over to Colette, who is going to finish us off. Thank you so much for your participation, and we look forward to seeing you next month. Colette, you want to finish us off?
Hi. So just a couple of events that are happening within our office. If you can, tomorrow, join us live for our Facebook. We are going to be talking about the fires and supporting children, families, and teachers through the trauma of natural disasters, focusing on ACEs, Adverse Childhood Experiences. So tune in tomorrow. You can go straight to the QR code and set a reminder. We also have our Cardiovascular Summit coming up on February 20th. We're going to be talking about Maternal Health Summit, Improving Cardiovascular Health. It's from 9 to 12. You can go ahead and click this QR code and register if you're interested. This is an in-person event. There will be no online participation. So if you're interested in coming to Sacramento and joining our event, go ahead and click the QR code below. Also for our cardio summit, we are looking for a speaker. We are looking for someone for an Asian community voice. If you are interested in representing the Asian community, please send us an email at strongstartandbeyond@osg.ca.gov. Again, we are looking for a speaker for our Asian community for February 20th during one of our breakout sessions. Lastly, if you haven't already, go ahead and click that QR code to partner with us to improve maternal health. You can find out more information on our website at strongstartandbeyond.org. And lastly, thank you. Thank you for joining our webinar today. We hope you learned something new, and we hope to see you next month. Thank you.